Hi, I'm Hilary Talbott, acupuncture physician and clinical herbalist, coming to you today from St. Petersburg, Florida. Today we will be discussing acupressure for morning sickness. Now, morning sickness can last anywhere from a couple weeks to the entire duration of your pregnancy. So it's something that can actually be a little bit life-altering. So I'm going to show you some simple places to press on the body to kind of help alleviate this kind of sickness, or at least take the edge off so you can go about your daily routine. So a common anti-nausea point that most of us know about is called pericardium 6. And that is located on the inside of the wrist, in between the two tendons, just where the vein crosses. So it's a little bit different on everybody. We're going to find where her vein crosses and go just below that. You want to apply gentle pressure in a pulsating manner while taking nice deep breaths, thinking about everything going down into the belly where it's supposed to be instead of coming up. This can be really effective while you're laying in bed in the morning, just before you get up, often where the morning sickness will be at its worst. Now, this point is great for nausea and vomiting on most of us, but when we're pregnant, there's actually another set of points that is actually a little bit more effective on most pregnant women. And this is located on the abdomen. And it's right up under the ribs, where the ribs come together at the xiphoid process here. And to find it, you're just going to put your fingers on either side of the belly button and run all the way up until just before you hit bone. And you want to just kind of gently put your finger there and listen. Sometimes there'll be a pretty strong vibration there if it's an active point for you. And you can just take your finger and your thumb and gently massage the points here and take nice deep breaths, thinking about everything going down into the belly. Now, when you're pregnant, it's important to have an acupuncture physician that understands this important point in your life and knows which points are good to use and which ones are contraindicated, because there's a lot of points that you don't want to employ until you're at the end of your pregnancy, because they could actually induce labor. So if you don't already have a qualified acupuncture physician, make sure that you seek out one that's skilled in treating pregnancy and fertility issues. You can find one on acufinder.com or aborm.org, aborm.org. I'm Hilary Talbott, and that was acupressure for morning sickness.